One of the great things about objective measure, and most of what we've done over the years, is to use machines or weights that have actual numbers to them. So if you lift 10 pounds, you know you're lifting 10 pounds or 20 pounds. A chronic patient typically comes into the clinic feeling like they can't do anything. They're impotent in their lives. They're impotent socially, they're impotent economically. People that haven't had pain don't get it. And so the people around a chronic pain person don't want to hear this anymore because it owns their lives. So they come into a clinic, they see exercise equipment, and they think to themselves, I can't even hardly get to this clinic. I'm not sure how I can do this work. But let's say, for example, you're using exercise machines, and the great value of them is you can measure. So for the purposes of this discussion, let's say that there are 10 weight machines. And on average, the patient's able to do 100 pounds of weight on each one of those machines. So maybe they do a little bit more with their legs and a little bit less with their arms. But let's say, for the sake of this discussion, that they do 100 pounds of weight on average across the 10 machines. And let's see, okay, now they do 20 repetitions of exercise per machine, which would take them about 2 minutes. So now we have 2,000 pounds of work on one machine in 2 minutes, times 10. That's 20,000 pounds worth of work that chronic pain patient did in a 45-minute or a 50-minute session. When they see that they've moved that kind of weight in that short period of time, and it didn't cause them more distress, it didn't hurt them, that's the beginning of a motivation that changes the way the patient thinks about themselves. Now they're not in a hallway from which there is no escape, meaning that they've gotten into a chronic pain hallway, they've been to several doctors that have medicated them and moved them on to the next doctor, and if they're chronic, they haven't gotten better. They've used all these different physicians, and as a result, they haven't gotten better, and now they feel that it's their fault. When you can show a success pathway like this, it allows them to see success, and success breeds success. Lyndon Johnson said, science is good, but results are better.